Hello and welcome to Lynchburg Live. I'm your host, Linda Smith, and tonight's program is the second in a two-part series on volunteer surgical missions for children in third world countries. My guest tonight is Lynchburg plastic and reconstructive surgeon Dr. Sam Fuller. I've worked with Dr. Fuller in the operating room since he came to Lynchburg a little over 20 years ago, right?
A little over 20 years ago.
A little over 20 years ago.
Thanks.
And I have to say that whenever I worked with you, it was always a good day.
Thank you.
In addition to his plastic surgery practice and making sure that life is pleasant in the OR for nurses, Dr. Fuller volunteers his time and surgical talents to a program called Operation Smile in third world countries. Welcome, Dr. Fuller. I'm delighted to have you as my guest. And as we start out, I'm going to ask you to please tell our audience what Operation Smile is.
Thank you, Linda. It's a pleasure to be here, and thank you for all your hard work in the OR for many, many years. Operation Smile is an organization dedicated mainly to repairing cleft lip and cleft palate deformities in children worldwide. It started in 1982 with Bill and Kathy McGee, who are from Norfolk. He's a plastic surgeon, she's a nurse, and just two wonderful people with 5 children, very busy practice, who went to the Philippines to give a lecture on cleft lip and cleft palate repair in Manila. And when he was in Manila, he, just walking through the street, said there are thousands of people with unrepaired cleft lips. What's up? And he said, you know, they told him, they said, well, there's no national health care and nobody can fix them. If you can't afford to have it fixed, it doesn't get repaired. And the adults, children, and everybody were very much seen as outcasts, with the cleft lip as seen as some kind of punishment for wrong deeds of some kind. And he decided, well, I'm going to come. I think something should be done about this, and I'm going to get together a team, and I'm going to come back, and we're going to fix 100 cleft lips. I'm going to get enough people. And he organized a trip and raised money to bring 5 anesthesiologists, 4 plastic surgeons, nurses, every piece of equipment necessary. And what Manila provided was a hospital, 2 operating rooms, and patients. And when he came back to fix 100 cleft lips, he said, now we're going to have to screen anywhere from 150 to 200 children to get enough for the ones that are sick and people that can't stay and people that don't understand what's happening, to make sure we have enough to do. And at his first return, when they went to screening, there were 700 children. You know, at which point he said, I think we're going to do as many as we can do, and we'll have to come back.
May I ask you a question?
Uh-huh.
Is this deformity more prevalent in that particular area?
It's a little more prevalent in that area, but not a lot. And we don't have an answer as to why. The Sam Fuller theory is, in the Philippines, if you've ever been to the Philippines, everybody's a cousin. Oh, you must meet my cousin so-and-so. And the Philippines is 7,000 islands. And you're thinking, how could you have so many cousins when you're so spread out? But I think there's a fair amount of intermingling that goes on, so that and it does tend to run in families. It's not necessarily a autosomal dominant deformity that's going to run through a family, but if you have a child with a cleft lip and cleft palate, your chances of having another one increase slightly. But anyway, he and Kathy started going twice a year to the Philippines. Then it was 3 times a year, and in about 1986, 87, they took on another country, and then another country, and they now travel yearly to 26 countries.
Oh my goodness!
And each country will have 2 to 3 sites of operations, and taking 30 to 40 people at each site, and doing between 100 and 150 cases. And to date, they have done 15,000. They've repaired 15,000 cleft lip and cleft palate, primarily cleft lip and cleft palate.
And that's since 82, you said?
Since 1982.
When did you hear about this program first?
I heard about it about 1982, 84,
okay.
And had started my practice in Lynchburg and started calling up to volunteer. And for 4 years I called, and they said, well, fine, we'll call you. And I never heard from them, and I'm thinking, well, this must be some kind of good old boys club, and I'm not a part of the club. And I made it a point in 1986 to go to our national meeting and meet Bill McGee, and to beat him and to say, Bill, I'm your neighbor. I need to go on one of these trips. And he said, oh my goodness, this is great. If you haven't heard from us in a month, call me back. In a month, I called him back, said, didn't hear from you. And he said, oh, that's terrible. I'll get in touch with my folks today. And 3-4 months later, didn't hear anything. I said, I don't have the right combination. And met someone at church one day that had actually been a volunteer working in Norfolk for them, and said, you're going about this the whole wrong way. He said, if you want to, Bill is great with ideas. And Bill is a wonderful surgeon and has all the ideas for everything we do. If you want something done, you need to talk to his wife, Kathy. And I called Kathy in November, and in January I was in the Philippines.
See, that's
so you just have to figure out how to play the game.
Go through the woman.
Absolutely, yeah.
So you were immediately interested in volunteering, whether you were immediately snatched up to volunteer
exactly,
or not.
Exactly. And so my first trip was in 1987. And I've gone once a year since then. Basically once a year since then.
Do you set aside time annually for this trip?
Yeah, I pretty much count on it. It's vacation time, but this is much more than any vacation could ever be. And early on, it took the trips to the Philippines and the sort of small amount of training that we had, and then the screening and everything. You were literally gone 17 to 20 days. So it was a big chunk of time. Now that they've got so many volunteers worldwide, and it's not just America does this. For the last 10 years, I've learned much more than I've imparted from the volunteers worldwide, which is another good thing to remind me to get to. Now, instead of flying me to the Philippines, halfway around the world to the Philippines or India, I will fly to Nicaragua, Colombia, somewhere close by, same sort of time zone, and most trips will take anywhere from 7 to 10 days now, which makes life a lot easier, and it makes more sense. And now we have volunteers that when I go to somewhere in Latin America, I'm one of the few people that don't speak the language, because if I'm in Nicaragua, we have volunteers that have trained in Honduras or in Nicaragua or Colombia that also come to meet. And one of the great, and I'm sorry I didn't bring that slide with me today, but one of the great slides I have is of an operating room in Morocco. And I am at one table. There are two tables. We're operating on children from Casablanca. And I'm at the head of one table, and a volunteer surgeon from Morocco is at the other head of the table. My anesthesiologist is from Italy. His anesthesiologist is from Colombia. The circulator at the end of my table is from South Africa. And the circulator at the end of his table is from Vietnam. And you look at that picture and you go, this is what will make the world a better place to live in, is for us to come and get together and do this.